Hello, everybody. My name is Golfran Rivera. I'm a board certified physician assistant. I practice family medicine and sports medicine here in Fayetteville, North Carolina, at my private practice, TrueCare DPC. And this is a talk I prepared, called Menopause Matters, Building a Resilient and Healthy Future, meant to help women understand their own health and hopefully provide some perspective on the medical field's understanding of women's health and give some useful tips and tools to help women improve and enhance their personal well-being. So before we get started, let's go ahead and jump into some disclosures. First of all, I am not a woman. And that's important because the truth is that a woman's experience is different than that of a man. And I don't pretend to imagine that I know what a woman's experience is like. And I have that in mind when I prepare this presentation. Now, with that said, I will tell you that my life is defined by women. And I say defined, not influenced by, but defined because really who I am as a man today is the result in many ways because of the women in my life. I grew up as a mama's boy, and to this day, my mom and I are very close. In fact, she is the administrative assistant for TrueCare DPC. And then my best friend and my life partner of 13 years is Desiree, and she's very much a woman, and we are raising a fiery little lady, 4 years old, Adelina there on the right. And I grew up. My best friend in home was my older sister, and we're still close to this day. And together we helped raise those twins on the bottom right there. And I didn't have any brothers, so very much my life was defined by women. The other important disclosure is that I'm an active follower of Jesus of Nazareth. Now, why that's important, and we'll get into greater details about this later on. But as much as people like to imagine that medical practitioners are objective, the truth is that we are human and we are influenced by our worldview. Now, we do our best to be objective in the clinical setting. However, it is the case that what we already believe and what we think about people, what we think about the world, influences the way that we understand information and the way we use that information. That's just a fact. And so for me, when I think about women's health and I think about my female patients, I have this in mind, that in the very first chapter of the Bible, describing the creation of mankind, it explains very clearly that God made human beings altogether to rule over everything. And it says here in the bottom line, God created human beings in his own likeness. He created them to be like himself. He created them as male and female. And so when I see female patients, when I am with women helping them in medicine, I see a fellow image bearer of God who is very much entitled to that dignity and that respect. And it's not lost on me that the Bible personifies wisdom as a woman. Right, here's from Proverbs 9, verse 1. Wisdom has built her house. She has set up its seven pillars. So um, just share this to tell you this is my view of women, how my worldview is informed by the things that I believe in my upbringing, and I'm bringing that into this presentation. And the last essential disclosure: this is not specific medical advice. Okay, if you do have specific questions and you want to ask me, you feel free to hit me up on the side and we can set up a time to talk. Or if you want to take some of this and go to your medical practitioner to have a conversation, please feel free to do so. But this is, again, not any specific medical advice. All right. So with that, this is going to be the remainder of our agenda today. I've gone over the disclosures. I'm going to give a brief introduction. I'm going to describe the menstrual cycle so I know we're all on the same page, and talk about why menopause matters. No matter what age of life you are in, it is an important stage of life that women will enter into. And then we're going to talk about the bias and patriarchal influence in medicine. Again, I mentioned to you, worldview matters, and it has impacted medicine's understanding of women's health. And then I'm going to close it out with some tips for building a resilient and healthy future. So, introduction. Let's start by defining some terms, right? So, menstruation. Menstruation is what most of us know as the period. This is the time in a woman's menstrual cycle, where in which the uterine lining is shed, and we usually consider menstruation the beginning of the overall menstrual cycle, which I'll describe in a little bit. Menarche is a term we use for the very first time that a young lady actually menstruates. So this is your very first period. And then in contrast, menopause is your very last period. Now, premenopause is technically the space between menarche and menopause. So this is the time of your life where you're still menstruating. Perimenopause describes a period of time where in which a woman begins to transition and make her way to that final menstrual cycle. And then postmenopause is the time after the fact that you've entered into menopause. There are some general ranges that we hear about or see, right? And you see in this chart, this kind of describes it in a linear fashion. It's worth noting that perimenopause really does include both the period before menopause as well as the period shortly after. It's not a perfectly straight line, but these are the general ranges that you'll see in the symptoms that you may experience in these different time windows. And I say general because every woman is unique and there are different things to consider, but this gives us a reference for us to think about. Now, I also want to talk to you about, real briefly, about hormones, because that's going to be an important thing that comes up. Now, hormones, the definition of hormones, interestingly, is the more that we learn about the body, the more we realize that our definition for things maybe needs some updating. And hormones is one of those things. So there's not a full-fledged consensus, but for the sake of this discussion, I'm gonna basically use hormones to mean that these are chemicals that organs in our body produce in order to act on other structures in the body and make functions throughout the body take place. Again, not a perfect definition, and there are things that meet that definition that wouldn't be considered hormones, but for the sake of this talk, I think it's going to be sufficient. So, briefly, let's look at a list of hormones that are found in women. Right, it's kind of an overwhelming list. There, we have at least 53 that we know of, and some of these are actually categories that have other hormones underneath them. But now let's compare this list of hormones that are found in women to the list of hormones that are found in men. Now, what do you notice, right? Aside from the change of color of the slide, it's the same list. Now, I want to bring that up because you may have heard in the past that estrogen and progesterone are female hormones or women hormones, and then testosterone is men hormones. But the fact of the matter is that they are human hormones. And the truth is that while women have less testosterone than men, they have more testosterone in their body than estrogen and progesterone. And the fact of the matter is men also have estrogen and progesterone. So the biggest thing is we vary in the amount. And then how we really produce this in our bodies. Now, that's just some food for thought in case anyone has ever told you or dismissed you as being hormonal. You can say, yes, of course you are, because we all are. And it's not actually a problem. It's just part of being human. All right. So with that, let's go ahead and talk about the menstrual cycle, otherwise known as, or also known as, the female reproductive cycle. Now, usually, this is usually the depiction that you see when it comes to the menstrual cycle, right? The focus of the discussion of the menstrual cycle is what's going on in the ovaries and what's going on in the uterus. And there's a reason for that, because the menstrual cycle does play a big part in these organs, right? So the ovaries, throughout the cycle, the ovaries are producing maturing follicles. They're responding to hormones coming from the brain, which we'll talk about in a second. And then those follicles are maturing. Eventually, one will release what we call the egg or the oocyte, and simultaneously, the uterus is getting prepared to receive that, should there be fertilization of the egg. In medicine, we usually think of this, or we learn this cycle in this manner. We look at it. So you see here, there are three different focuses here. We have the two phases that are broken up, the follicular phase and the luteal phase. And then we look at hormone levels, we look at the ovarian cycle, and we look at the endometrial cycle. So we still have what's going on inside the ovaries, and we still have what's going on inside the uterus, which is the endometrium. But we're also paying attention to what's going on with the hormone levels throughout the cycle. What I want you to see here is we have 4 different hormones that we kind of hone in on. It doesn't mean that the other hormones on that long list aren't being affected. This is what we hone in on when we talk about this. So we have in the blue follicle stimulating hormone. We have in the dark purple luteinizing hormone. Then we have in that pinkish color estrogen, and then green progesterone. And what I want you to see is that as the phase goes on, so we start with the follicular phase, there's a increase of follicle stimulating hormone, which leads to a small bump in estrogen, and then FSH starts to go down and estrogen starts to rise, and then there's this what we call a luteal surge right before ovulation, and then there's this drop in estrogen, and then there's this increase in progesterone as you go along. Now, the menstrual cycle is this is happening because, again, that FSH and the LH, they're coming from the brain. They're working on the ovaries. The ovaries are responding by the follicles inside the ovaries, maturing and releasing a few different chemicals that eventually get converted to estrogen, and that's acting on the endometrium, and that's changing the endometrial lining. All these things are taking place. But I want to zoom out just for a second here. So remember that at the start of this, I called it the menstrual cycle, otherwise known as the female reproductive cycle, right? And again, I showed you this picture where we have the uterine lining change, and then we see the something going on inside the ovaries. But look at this chart again. What if we zoom out and we look beyond the ovarian cycle? We look beyond what's happening in the endometrium. What are we still left with that's relevant? We're still left with important, significant changes in the hormones of women. We're seeing these shifts and these responses are happening, resulting in changes in estrogen levels and changes in progesterone levels. And like I said, these hormones are acting on the ovary and the endometrium. That there's stuff happening there, but it's not just localized to there. Here's what I mean. Again, this is the list of hormones found in women, and these are the systems affected by all those hormones, right? Now let me show you what the systems are that are affected by estrogen and progesterone, which are produced during the menstrual cycle. What do you notice? It's all the systems, right? Because throughout the body, there are estrogen, progesterone receptors, and these hormones act on in different ways and to varying degrees on these different systems in the body. I wonder if this may explain why through various stages of the menstrual cycle, women feel different and experience different things, changes in mood, changes in sleep, changes in focus, changes in energy, changes in digestion, right? I wonder if perhaps that is because there are receptors throughout the body, and this menstrual cycle changes this estrogen and progesterone levels, and it's in fact in the body. And of course, I'm being facetious. I would say, of course, this explains why women experience these things as they go through their menstrual cycle. Now, with all that in mind, let's talk about why menopause matters. Okay, first of all, what is menopause? Right? Well, at the start, I gave you a brief definition, but you know what's interesting is I was looking this up, and it pertains to how we think about women's health. Is the answer to this question, what is menopause, really depends on who you ask. Here are different answers to the question. One of my favorites, I went on Facebook and I asked the Facebook audience if they could tell me how they would describe menopause or what names they have for it. And some of my favorites were murder pause and the internal furnace. That kind of made me chuckle. And it's also, a little sad to think that that's what people go through. But here we have something like Sin al-Ya'as, which is age of despair. And this is in the Middle East. There's actually efforts to change that name. But then you have in China, they use a word that means second spring. In Japan, they use a term that really just means this is a change in life and a change of life period. And so what I really want to capture here is that what menopause is is something that is influenced by culture. In fact, what's interesting is there are some indigenous cultures around the world that think of menopause as the stage where women enter into wise womanhood. I found that very fascinating because the belief in some of these tribes is that when a woman is still menstruating, because they believe that life is in the blood and part of her vitality is in that. And so when she's menstruating, she's losing some of that vitality, losing some of her wisdom, and losing some of her energy in trying to produce life inside of the womb, inside of the uterus. And so it's believed that when they no longer menstruate, they retain that energy, they retain that vitality. And in fact, in some cultures around the world, menopause is a requirement for women to enter into leadership roles, to be priestesses, to be considered elders, because it's actually something that is held in high esteem. Now, in the medical community, where we have our own culture and our own way of communicating things, we have this definition. This is from the North American Menopause Society, and this is how they describe it or define it. Menopause is the final menstrual period, which can be confirmed after 12 consecutive months without a period. This time marks the permanent end of menstruation and fertility. It is a normal, natural event associated with reduced functioning of the ovaries, resulting in lower levels of ovarian hormones, primarily estrogen. Now, what I really want to emphasize to us here is this last sentence. It is a normal, natural event associated with reduced functioning of the ovaries, right? Resulting in lower levels of ovarian hormones. But the first piece there, it is normal, meaning it is not a disease, it is not a dysfunction, it is not a disorder, it is not a curse. Okay, it is a normal part of women's health. And why I think this is important, I'll get into just a little bit more from a health perspective, but I want us to think about that because every young woman, no matter how healthy you are today, how you feel today, how you're menstruating, eventually, Lord willing, you live long enough to enter into this stage. And as you'll see in just a second, the things that you are doing today can actually impact your experience, including how you talk about it, how you think about it, the cultures that you're a part of, and the cultural views about menopause. Let's talk about the influence that menopause has on your health. Okay. Once again, remember, we were saying that estrogen and progesterone impact the entire body. And here are some things that we've seen in medicine becomes more common in women who have entered menopause or in the perimenopause stage of their life or they're postmenopausal. We see an increase in cardiovascular disease. What's interesting is before menopause, women have less of a risk than men. But once they enter into menopause, they actually catch up and then exceed that risk as the years go by. We see an increase in vaginal dryness, increase in urinary incontinence, frequency of UTIs, decline in sexual function. Importantly, there's an increase association between metabolic syndrome and menopause, and a big one right here: rapid reduction in bone density. We all start to lose bone density as we age, but in women, it was observed in some studies that the rate of bone loss increases threefold as you enter into menopause, and then it slows down a little bit but stays more accelerated than it was before after menopause. And we've noted that women complain about cognitive decline, and we see an increase in anxiety and depression during menopause, and then there's an importantly uncomfortable changes in sleep pattern. Now, importantly, not every woman experiences these things. Not every woman experiences all of these things or some of these things. Some women would say that aside from maybe hot flashes or some changes in sleep, they felt very comfortable. And we have found that different cultures around the world report differences on the level of severity or frequency on some of these things. And there's a question of, is it because the culture does not promote open communication? Is it because the culture welcomes menopause in a way that makes it, much more positive experience? Is it because of lifestyle factors like the way people are eating, the way that they're moving, that they're reducing the risks of some of these things already? Those are important questions that we ask ourselves. But this why it is the reason why this slide is titled "The influence of menopause and not things that menopause causes. Okay, so it's something that it plays a role in, but not necessarily a definitive role. However, when we look at this, we can see that its influence can be pretty significant. Now, you may see that and ask yourself, well, if so much of that health stuff comes up, why does it seem that clinicians don't care? And I ask this question because so many of my patients and my friends and family have indicated to me that they have felt dismissed, they have felt gaslit, and there is this tension in medicine regarding these health concerns for women. And I would tell you that it's in many ways it's due to people like this gentleman here. Now, I don't know who this man is. This is a stock image. But the uncomfortable truth about medicine in the United States, and this is where we get into worldviews and mindsets, is for a long time, medicine was a man's world. In fact, the American Medical Association is, in fact, responsible for racism and sexism in medicine. And this is a documented fact, which they have come out and apologized for. But it's true. They for a long time, they kept women out of the medical field and passed many different regulations and policies that prevented women from really participating. Um, Over the last century, in the 1900s, when clinical research really became a thing, women were not very well represented in those trials. The FDA passed a few regulations to kind of discourage the involvement of women who were of age to have children. And then, of course, there was some sexist views that were at play there. The National Institute of Health didn't even make any kind of formal recommendations until July of 1989, and it wasn't even followed by many. So it wasn't law that women needed to be involved in medical research until 1993, which was in my lifetime. So it hasn't been that long where the world of medicine really kept women out. And that's part of why there is a limited understanding about the significant role. And there sometimes may feel like there's a limited concern for these issues. The other thing is that there really is a lack of training as well. It was only in 2018, that was 5-6 years ago, that AARP reported just 20% of OBGYN residency programs provide any kind of menopause training. Okay, and it's mostly elective, and nearly 80% of the residents say that they felt barely comfortable. And then a small study in Duke University looking at medical students going through their OBGYN clerkship said that at the end of that, they felt ill prepared. The majority of them felt ill prepared for managing menopause symptoms. And then last year, a survey, which was conducted by the North American Menopause Society, they found that only 30% of those residency directors that responded to the survey, which I think was just under 100, that responded, only 30% of those said they had any type of menopause training in their residency. And so what can you do about it, right? If the medical community is still coming out of those dark ages and they're still growing in their understanding and their training to help women who will go through menopause, what can you do? This is where we talk about some tips that will help you, things that you can do to help prepare yourself for a resilient and healthy future. Something I share with all my patients is focus on the 5 pillars. This is what I call the 5 pillars of health, starting with strength training, right, and regular exercise. So the general recommendation is for you to do 9 to 12 movements a week that involve more than one joint. So for example, instead of doing a bicep curl, doing a pull-up, right? Because that involves the elbows, the wrists, and the shoulders. Instead of doing tricep extensions, you're doing a push-up because again, elbow, wrist, elbows, and shoulders. I'm doing 9 to 12 of those type of movements. And then 3 to 4 working sets when you do them, 8 to 12 reps at a time with at least about a minute and a half. And of course, there's variability in this, and this is where having a health coach or a personal trainer can be useful. And a general concept to have in mind is that as you strength train, you're going for hard but doable. All right, a lot of people that tell me that they exercise, when I ask, okay, well, how hard is the work that you're doing? They'll tell me that they can carry conversations. It's not a lot of heavy weight, and you're not getting the same benefit when you do that. So hard but doable should be the goal for every single working set. And then another thing is, I tell people, look, unless your livelihood depends on your physique, when you're strength training, the focus should be strength, not physique. Okay, it's nice if you have some sort of physique goals and you're getting to reach them, but the focus of what we're doing here is strength, not physique. And then lastly, this is separate from strength training, which is cardiovascular exercise, and that would be the recommendation is 150 minutes a week of moderate intensity. So, if you break it up into 5 days, that's 30 minutes a day. If you break it up into 7 days, then it's a little bit less. And moderate intensity, right? This is the big one that we need to get. It isn't a casual conversation that you can carry when you're doing this. No, like, you shouldn't be gasping for breath or dying, but you should be having to focus on your conversation because your heart rate is up, because your breath rate is up. Okay. Now going into diet. Diet is an interesting topic that's definitely, I think, fallen victim to a lot of social media misinformation. I try to keep it simple. Definitely there's a place for getting into macronutrients and micronutrients and energy balance and all that. There's a place for that. But for most people, I think a starting place is to aim for whole foods as often as possible. Basically, as much of keep the majority of your food out of packages and boxes and wrappers and cans. If you can get a whole food version, better. Protein and fiber, getting enough protein for yourself and getting enough fiber. This is huge, and so many of us are worried about how many calories and organic versus this or that, and you're not even getting the basics of enough protein and enough fiber. Big deal. Mindful eating. A lot of people come to me and they want a detailed plan. Eat this much at this time, but I focus more on our behaviors around eating and our perceptions of the food that we eat, our relationship with food, and being mindful of the different cues and our different emotions and our different motivations behind the food that we eat. Portion control. Portion control is important. I'm not talking about starving yourself, but knowing what is the right amount for what you actually need versus what could be considered overindulging. And something that helps with that is a food log, right? A lot of us will try to recall what we eat, and it's not as accurate as having an actual food log or a food diary that helps us really track what's going on. The other thing is, I encourage people to avoid any extremes. I tell people all the time, the only thing I'm dogmatic about is that Jesus died and rose again. After that, there's a lot of nuance in life, and diet is no exception. So I'm open to any diet that you can stick with, that you enjoy, and that is helping you live a healthy life. And sleep. Oh my goodness, sleep is something that is so underrated. Definitely, you should be practicing good sleep hygiene, setting up a good sleep pattern and schedule. Being regimented in that, I think, is very helpful. Train yourself to only utilize your bed for sleep and sex, and give yourself that 7 to 8 hours, maybe even 8 to 9 if you can. But sleep hygiene is such a big deal, and it's something that I work on with a lot of my patients because the impact of sleep in your life and your stress, huge. And then relationships. This is big. I think I don't think any of us live in a vacuum. No person is an island, and the relationships that we have impact our health. Okay, so I tell you need to invest in time with the ones that you love. You need to find at least 3 people that you can really confide in. And as you're going through these health changes, you want to have a crew that you're comfortable talking about these changes in your body. Learning how to establish healthy boundaries is always beneficial, and learning how to communicate clear expectations between yourself, your loved ones, and even your clinician. That's an important part of your health journey. And the last thing is spirituality, and this isn't about religion. This isn't about a specific dogma, but it's more about being clear about who you are and what you believe about yourself and the world that you live in. Through your life, you're going to go through various changes and changes, and menopause is not an exception, right? It's significant physical changes. There's cultural things that go around with this. So being clear on who you are beforehand is going to be beneficial rather than trying to discover yourself then and there. I recommend answering these 3 questions for everybody. Who are you? What does that mean for your life? And does the way you choose to live today accurately reflect who you are? Taking some time with that, I think, really helps people clarify some things for themselves and get a clear picture, a sense of identity and purpose. And so, with that, that's going to conclude my talk here about women's health. And I want to just emphasize it's about more than fertility. Your menstrual cycle is more than just fertility, it has big impacts on your overall health. And menopause is normal, but it can have significant impact on your overall health. And I want to impress upon you that medicine is still learning a lot about how we can better help women. And so I give you these 5 pillars that you can focus on to enjoy a current life wherever stage you are now. And if you're going into or having already entered the menopause stage of life, that can still benefit you and improve your overall well-being. And with that, here are my works cited pages. And unless you have any questions, this concludes my talk.